Let me ask you, first of all, about being involved in this process. What struck you as you were reviewing this mountain of research and coming up with the guidelines we have today?
I think, the volume of research that's come out about alcohol-related risks in the last decade has been phenomenal. And so it was a lot of work on behalf of the panel and those working on this project to navigate that literature and really come up with the most evidence-based, up-to-date, accurate findings to inform people living in Canada about alcohol-related harms.
At the end of that process, we have these guidelines, and as I was mentioning, no amount of alcohol is safe, is what you found. 2 drinks a week, low risk. And that's a big change because before it was different for men and women. Men, 15 drinks a week. Women, 10 drinks a week was considered okay. Now they're the same, just 2, low risk. Why a departure from the sex-specific limits?
Yeah, it's a great question. And based on the most up-to-date evidence, we found at low levels of consumption that there wasn't any difference in risk based on the physiological differences between males and females. But that said, the nuances of that, and you can see that in the report, is that once we exceed the high level of the moderate range, so 6 or more drinks a week, females' risk actually exponentially increases relative to males. And so there are differences in risk, but those differences don't show themselves at low levels. And I think it's really important to remember, though, that even though women's risk increases exponentially, men by far are still drinking more and are experiencing more alcohol-related harms than women as a whole.
Okay, that is a big part of it, and thank you for that differentiation. We were looking at the screen and the guidelines 2+ and then 6+ and more than that, anything beyond 6. We had a question from a viewer, and he was wondering whether there are certain types of alcohol that are worse than others, as you found in your research. Wine versus beer, red wine versus white, are they all considered standard drinks for the purposes of these guidelines?
Yes, they are. I know this has been something that's been around a long time about red wine being good for the heart, but the literature has come a long way, and there's really no evidence that alcohol is good for us in any capacity, and that it doesn't matter what type of alcohol it is, that less is better.
Okay, Raj, thank you for the question. And Professor, thank you for the answer. One of the things that's come out in this evolving body of literature is the link between alcohol and cancer. And that is very clear that it may be surprising to Canadians, the links to some 7 different forms of cancer. We got an email, Professor, from Brian, who said his father drinks a beer every day. He's 86 with no health issues, so he will not be changing his drinking habits, he wrote. He's more concerned about breathing in secondhand smoke from smokers in public. So, raising smoking, there was that direct link. Smoking causes cancer. There's no easy causal link with alcohol and cancer. It was clear age, lifestyle, genetic history all may factor in. So, how do you get people to take that connection seriously?
Yeah, there's very low awareness, I think, of the link between alcohol and cancer, but it's very clear that alcohol is a carcinogen, that it is directly linked to cancer, and 7 different types of cancer. Every year, over 7,000 Canadians die from cancer that was alcohol-related, particularly breast and colon cancer. And I think the challenge with the example you gave is this understanding of risk. Not everyone who consumes alcohol is going to get cancer, but the risk for more you drink, the greater that risk is. And so it's really about individuals just being informed that that is a risk that comes with consuming alcohol, and that they have to make decisions that are right for them in terms of how much risk they're willing to accept.
And yet there is that hardline statement of no amount of alcohol is safe. And we know how normalized it is in our popular culture. And again, another viewer, Kevin, writing, it's one of the few pleasures I have left in this life. That's what he told us just this morning. So how to change behaviors when it is such a part of culture and when people do enjoy it so much?
Absolutely. And I think what I want to make really clear is that by no means are we trying to tell people not to drink or to how to drink. Our goal of these guidelines is to inform people of how, of the risks associated with alcohol, and ultimately let them decide what is best and what works for them. For a lot of people, 2 drinks per week is going to feel like a limit that they're not able to achieve on a regular basis. But our goal would be to have people just reassess and evaluate their alcohol use and try to reduce it by any amount. Any amount that they reduce will reduce their risk of harm.
I thought that was interesting in the study. The benefits are clear of some reduction. Many of the health effects, negative health effects, are reversible even by any degree of alcohol consumption reduction. In terms of making people aware of all of this, Joanne wrote to us that the warnings that are on cigarettes, why are they not on alcohol bottles along with the pictures? This would probably scare more people. Thank you, Joanne, for that. That's a big part of your report. It makes a big push for labeling on alcohol containers, Professor.
Yes, we are fully in support of alcohol warning labels. And they're likely not to look the same as cancer on cigarette packages, those types of labels. But what we are asking is that the government really think about adding labels to alcohol containers that tell individual consumers how many drinks are in their beverage containers so that they can make more informed decisions about how many drinks they want to have, and that they are informed of these guidelines and know where to access more information, and that they are also warned of these very important health risks that are associated with alcohol.
Health Canada has told CBC News it's going to examine the guidelines, so we will await any action on the agency's part. I'm wondering overall, at the end of this, I dare say it's going to cause some real reverberations today, now that the guidelines are finally out. What impact, what effect do you hope this has in Canada, this new report and these new guidelines, Professor?
I hope that they bring greater awareness and to alcohol consumption and the risks that it poses for us as a population. There are people in Canada, across Canada, experiencing harms from alcohol every day, and they have the right to know about this information so that they can make more informed decisions and reduce their risk of harms. And so the takeaway is to really increase Canadians' awareness, and all people living in everywhere of Canada, of the harms associated with alcohol.